Social workers help people get through tough transitions in life, and they do so much for the community. So we want to take a minute to celebrate their hard work. Natalie is here from Family Resources. First of all, Natalie, thank you so much for chatting with me today.
Yes, thanks for having me.
Of course, we appreciate you being here. Now, March is actually Social Work Month, and this year's theme is about empowering social workers.
Yes.
So talk a little bit about your team of social workers and what they do to help people right here in our community.
Yeah, so Family Resources has a good chunk of social workers. Predominantly, they're in our clinical department providing therapy and counseling services, but they're also providing advocacy, education in the community, and some of our awareness events.
It's a difficult job.
Definitely.
From what it sounds like. Okay, Family Resources provides trauma-informed care. This is something that you pride yourselves on. So we do have a graphic that you guys provided that helps explain why trauma-informed care is so important. So walk us through that. It starts with Realize here on the screen.
Yeah, so trauma-informed care is just acknowledging the need to understand a patient's life and experiences, delivering the most effective care that we can. We have found statistically in studies that it has the potential to improve client engagement, treatment adherence, health outcomes for both provider and staff that work at trauma-informed agencies. It involves clients and staff understanding trauma and knowing that everybody probably has experienced some kind of trauma in their life and planning the services around that to really...
Around this is right here. So realizing,
Yeah.
recognizing it, responding to it, and then resisting re-traumatization. So
Yes.
when a patient is getting treated, you kind of touched on this, involving the client in the treatment process.
Yeah.
Why is that so important?
Yeah, if clients aren't the ones creating their goals or creating the treatment plan, they're probably not going to follow it. You know, if they are the experts on their lives, the experts on the care that they need, and we're just here to help facilitate that and, you know, help them improve their lives the best we can.
Of course. Screening for trauma, what is involved in that?
Yeah, so at our agency, it's just questionnaires about the kinds of trauma you could experience, what has happened, kind of a life screening questionnaire.
Do you think a lot of people would be surprised to find out that they've experienced trauma? Like, is that something that you guys run into a lot as social workers where, you know, people have a hard time or resist kind of, you know, looking at themselves in that way? But truly, I think most people have experienced some type of trauma.
Yeah, sometimes when you ask those trauma questions of have you experienced this or this, a lot of people don't identify that as trauma. It's just something that happened to them and that's part of their life story. And then when we kind of point it out as something like that, it's eye-opening, and then it evolves their treatment plan and their goals, because now
they can start to feel better once you identify it. Okay, so right now you guys are looking for some help. You've got intern and volunteer opportunities, so talk a little bit about those and what that entails. Yeah,
we have a ton of internship and volunteers on our website. Currently, we have about 5 counseling master level students at our agency providing therapy to clients.
Wow.
We also have interns doing advocacy in our survivor services program. As far as volunteering, we have kind of everything from our donation center to admin work. As spring is coming, doing like outdoor stuff to keep campus looking beautiful. So you can always visit our website under the Ways to Give tab. We have a list of volunteer opportunities.
Okay, and talk a little bit more about the internships and what the benefits are for somebody wanting to intern with you guys.
Yeah, so specifically like the counseling interns, they're getting clinical experience from licensed professionals. They're getting hands-on experience with clients who've experienced a wide variety of trauma, of just life experiences, and that's really awesome to have before you even graduate with your degree. And
yeah, nothing better than that real real life, real world experience
Yes.
to kind of teach and immerse. So our viewers have likely heard of Family Resources at this point, but you guys do so much for the community. Not everybody knows about all of those things. So before we let you go, just talk a little bit more about the different services that are offered at Family Resources.
Yeah, so Family Resources has been around for over 175 years. We're most well known for our advocacy and for our 24/7 response to the hospital. Obviously our counseling and therapy that I've talked about a lot. We also have our emergency shelter. We do a lot of safety planning, advocacy, education in schools, and all of our awareness events for all of the months that we.
Yeah, I think a lot of folks would be surprised just by heading to the website just to see everything, all the services that you guys are
Yes.
there for people for. Okay, so, and we want to put that website up on the screen for folks. If you want to learn more about Family Resources or just check out the internship or volunteer opportunities, visit the website at famres.org. Natalie, thank you so much for being here today and talking with us.
Thank you for having me.